We really believe as providers that we're on this journey and on this path directly with the patients.
Gina Bartasi, founder, chief executive officer, Kindbody. Welcome to Health Matters.
Thank you, Gary.
I'm so excited for this interview, but first, I'm really excited to figure out why you chose the Evergreen Machine smoothie.
I love spinach and pears and ginger and the yogurt.
So I'm a consumer, I'm thinking about my health plan, I'm thinking as an employer, how does Kindbody work?
Kindbody is in the provider business. We feel that you have to be in the doctor business, you have to be in the delivery of care to really effectuate change. What we really want to do is increase accessibility to fertility treatment, which has historically been for the top 1%. We have consumers that come into our fertility and women's health clinics, but we also go direct to employers now. So you'll see employers buying direct benefits from Kindbody and saving on average about 30 to 50% in savings in their fertility healthcare costs.
How are employers seeing it today? Are we seeing that employers are saying, no, this is something we do want to provide for our people?
Yeah, the biggest challenge for employers is the same thing for patients, and it's always about affordability. What we learned in selling into large self-insured employers is they've already made the decision to remove the middleman, the insurance company. They're bearing their own healthcare cost. So when we talk to large self-insured employers, they want to negotiate directly with provider groups. Today, many large employers, small employers are adding a fertility benefit. In many cases, it's at the request of the employee at the member population level.
What role does technology play in this? Because we're talking about a clinic or an environment or a physician's office or whatever way you would want to refer to it. There's more than just seeing the doctor.
We believe that the only fundamental way to change healthcare is you must first invest in technology. So when we started Kindbody, before we had hired any clinicians, we actually bought a proprietary tech stack from one of the leading scientists in the field. The reason we feel like it's fundamental is employers and payers today expect real-time data to make real-time evidence-based clinical decisions. Having our own technology, we can confirm with the employer, with the payer, that there's not duplicity in payments and charging for the same ultrasound scan. And so removing the waste in the system and allowing for the transparency and pricing really starts at technology.
So we're bringing back to the algorithm and the data, putting it into the provider's hands in order to best determine the right outcomes. And what kind of outcomes are you seeing?
Pregnancy rates across the board have increased about 30% from where they were 3 to 5 years ago. That's been done with genetic screening. So high pregnancy rates, low miscarriage rates, bringing care directly to the patient really is the future of healthcare.
So if you could change just one thing about how the way healthcare is delivered today, what might it be?
I think the challenge is all of these new innovation solutions, trying to decide who's adding cost to the system. And in order to provide more transparency at lower cost, we've got to remove all these layers and go back to how medicine and healthcare should be delivered. And that is from patient to provider and shortening that direct access instead of all of these middlemen creating waste in the system.
Gina, thanks again for being here. We're so proud of you and excited for you. Cheers.
Yeah, really appreciate it.